Hi, my name is Kaya Ingram, and I will be presenting today on ADHD treatment and what are the best options for treating ADHD, especially for children in America. So, what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. And this is very important to our society today because it affects 5% of children in America. Many studies have done the research, and that is the average that they have found. Now you can see that that is a lot of people, a lot of children that have this struggle and will be struggling with it their entire life. With ADHD, there are two subtypes. There's inattention and hyperactivity. Inattention subtype is where the child has a hard time focusing. Their eyes probably wander. They cannot pay attention as well, and things like that. Whereas hyperactivity subtype is where the child cannot sit still, so they have to be constantly moving. Now, it is possible for children to have both of these subtypes together. It is also possible for them to just have one or the other. And I am not exactly sure which is most common. I could not find that in the research. However, they are both fairly common in children. And the treatment options for attention deficit hyperactivity disorder are typically medication and or therapy, just like most other mental illnesses. And so for medication specifically, there are many pros and cons of why you would or would not treat children and adults with medication. The main medications they use are NPH, stimulants such as Ritalin, amphetamines, and atomoxetine are the mainly prescribed medications that are given to children and adults who have ADHD. And this is a pro because there are different types of medications. It's not just one medication that we rely on, but there are different types that we can specifically give to people who need them. So that is definitely a pro for medication. Another positive thing about medication is that there are fewer hospital visits for those who are treated, and also a lower risk of physical injury. These two go hand in hand, and it makes sense when you think about ADHD and how if a child is being hyperactive, of course they are more likely to injure themselves. They're more likely to get into trouble without really thinking about it and knowing what they're doing. And so they're more likely to get themselves injured and be hospitalized. However, as they are taking their medication, that risk, we would hope, would go down, and we can see that it does, which is a very, very positive thing. We are very grateful for that. Another pro for medication is that it has a more immediate effect on ADHD symptoms compared to therapy. So medication, you can see the effect within a couple days usually, if not sooner, especially for inattention and hyperactivity. The effects are fairly immediate, which is good, especially for those who could be at risk for physically harming themselves. Some cons for medication, however, are that there was a study done that said that 12.6% of their patients who had ADHD and were taking medication prescribed reported cardiovascular effects other than systolic and diastolic blood pressure. That is a pretty big number. And we, of course, want to minimize the effects, especially health effects or adverse conditions of medication that could occur. And so that is definitely something that we would want to see lowered if we want medication to be the main source of treatment. Another con with medication is that a lot of, especially children, but even adults and teenagers have a hard time taking and staying on their medications, specifically for ADHD, but I'm sure with most medications. Part of the reason for this could be, for example, if it's a child, perhaps their parents don't really want them on medication or believe in medication, so that affects the child's beliefs, and they then no longer want to take it either. And the hospital, the therapist, psychologist cannot regulate that at home. And so that can be really hard. One of the hardest things about that is this last con here, that forgetting medication can lead to unintentional physical harm or adverse health conditions. And that is something that, of course, we want to avoid. We don't want these children or adults accidentally harming themselves or others, or having other health conditions that may negatively impact their development. And so these are some cons with taking medication that are definitely possible, especially in the misuse of medication. Medication is very easy to misuse, and it is hard to regulate at home. Now for therapy. So therapy is the other way you can treat ADHD. Some of the pros for therapy is that it treats both subtypes of ADHD more easily than medication does. Medication is harder to adjust and specify for certain subtypes and for certain symptoms. So whereas therapy is much easier to adjust according to the needs of the patient, depending on the therapist and their experience as well. But typically therapy is a lot easier to adjust according to needs. Another pro for therapy is that there are lots of different kinds. Just like with medication, there's different kinds. So there's cognitive behavioral therapy, CBT, there's communication focused therapy, CFT, and behavioral therapy, BT. That all of these have slightly different approaches, but ultimately they have very, very high effect sizes and get the same or better results as medication, which is another benefit of therapy, because it has very good results, very effective on treating ADHD symptoms, which is what we like to see. Also, with therapy, you do not have to rely on medication, and instead it gives you the person with ADHD, the patient, some tools that they can then use at school and at home and in other places. And this is really beneficial because with the medication, you just have to constantly be taking the medication all the time. Whereas with therapy, it can teach you tools that then puts the child or the adult with ADHD in charge, and they can then do those things and use those tools on their own. However, there are some cons with therapy as well. It does take longer to be effective, so compared to medication, which is definitely hard, especially if we see those children who are prone to physical harm or harming others, things like that. That would be a case where medication would probably be the best bet. However, therapy is also useful. Some other cons with therapy, however, are it's hard to sustain and needs reinforcement. You usually need a couple appointments in order for therapy to be effective. It usually has to go over a couple of weeks, but it depends on the type of therapy as well. Another con, so this was a pro, but it is also a con, is that there are many different types of therapy, and that makes it hard to unify these practices. I would also add on to that there are many different therapists, and even if they use the same type of therapy, I'm sure they use it in different ways. And so it is easy to stray from the path that therapy offers. So as you can see, ADHD does affect childhood development a lot. Since ADHD affects 5% of children, as I mentioned earlier, it is vital that we learn more and understand more about it in order to better help those who have ADHD, because an effective treatment is important for the development and health of these children, and especially for their success in schools. And so I hope that you have enjoyed my presentation and that you will take in consideration having therapy either as the first resource or having it with medication in order to best help these children. Thank you.